Dear Marci, Medicare questions answered. Question, Dear Marci, my friend mentioned they save money on their prescriptions through a program called Extra Help. How can I find out if I qualify for this program? By Frank in Omaha, Nebraska. Answer, Dear Frank, Extra Help is a federal program that helps pay for some to most of the out-of-pocket costs of Medicare prescription drug coverage. It is also known as the Part D low-income subsidy. Extra Help can pay for your Part D premium, lower the cost of your prescription drugs, let you switch Part D plans more often, eliminate your Part D enrollment penalty if you have one, and if your monthly income is up to $1,843 in 2023 or $2,485 for couples, and your assets are below certain limits, you may be eligible for Extra Help. You can view this eligibility chart for more details. Even if your income or assets are above the eligibility limits, you could still be eligible for Extra Help because certain types of income and assets are not counted. Also know that if you are enrolled in Medicaid, Supplemental Security Income, or a Medicare savings program, you automatically qualify for Extra Help, regardless of whether you separately meet Extra Help's eligibility requirements. You should receive a purple-colored notice from the Centers for Medicare and Medicaid Services informing you that you do not need to apply for Extra Help. Remember that Extra Help is not a replacement for Part D or a plan on its own, though. You must still have a Part D plan to receive Medicare prescription drug coverage and Extra Help assistance. If you do not choose a plan and you apply and qualify for Extra Help, you will in most cases be enrolled into one. If you think you may be eligible, I recommend that you apply through the Social Security Administration. You can apply online or call or visit to get a paper application. Marci. Question, Dear Marci, can Medicare help with transportation even if there's no medical emergency? I'm hoping to better understand Medicare's coverage of ambulance rides. By Gia in Baltimore, Maryland. Dear Gia, Medicare Part B covers emergency ambulance services and, in limited cases, non-emergency ambulance services. Medicare considers an emergency to be any situation when your health is in serious danger and you cannot be transported safely by other means. If your trip is scheduled when your health is not in immediate danger, it is not considered an emergency. Part B covers emergency ambulance services if an ambulance is medically necessary, meaning it is the only safe way to transport you. The reason for your trip is to receive a Medicare-covered service or to return from receiving care. You are transported to and from certain locations following Medicare's coverage guidelines, and the transportation supplier meets Medicare ambulance requirements. To be eligible for coverage of non-emergency ambulance services, you must be confined to your bed, which is unable to get up from bed without help, unable to walk, and unable to sit in a chair or wheelchair, or need vital medical services during your trip that are only available in an ambulance, such as administration of medications or monitoring of vital functions. Medicare may cover unscheduled or irregular non-emergency trips, but if you lived in a skilled nursing facility, a doctor's written order may be required within 48 hours after the transport. Medicare may also cover scheduled regular trips if the ambulance supplier receives a written order from your doctor ahead of time stating that transport is medically necessary. Medicare never covers ambulette services. An ambulette is a wheelchair-accessible van that provides non-emergency transportation. Medicare also does not cover ambulance transportation just because you lack access to alternative transportation. Part B covers medically necessary emergency and non-emergency ambulance services at 80% of the Medicare approved amount. In most cases, you pay a 20% coinsurance after you meet your Part B deductible, $226 in 2023. All ambulance companies that contract with Medicare must be participating providers. Note that if you are receiving skilled nursing facility care under Part A, most ambulance transportation should be paid for by the skilled nursing facility. The skilled nursing facility should not bill Medicare for this service. I hope this helps. Marci.